Professor Weber, what are infected bones, the so-called osteomyelitis, and how can it be diagnosed?
Osteomyelitis is a serious infection of the bone and bone marrow, often arising after open fracture or surgical interventions. Infection can delay healing, cause bone loss, and, if untreated, result in chronic pain, deformity, or systemic illness which can lead to amputation. Osteomyelitis, the infected bone, is diagnosed through a combination and clinical signs which are pain, swelling, redness, fever, laboratory markers of infection, elevated white blood cell count, CRP, ESR, and imaging like X-ray, MRI, and CT scan. Cultures from the wound or bone biopsy are necessary to identify the causative organism and to allow antibiotic treatment where the bacteria are sensitive of.
Professor Weber, what is the treatment approach for bone infection?
Soft tissue coverage. In case of major tissue loss, plastic surgical procedures such as muscle or skin flaps might be necessary. Stabilization. If the bone is unstable after debridement, means removal of the infected tissue, external fixators or internal devices may be required. Surgical debridement, removal of infected, dead or poorly vascularized bone and tissue is the cornerstone of the treatment. The removal of the infected bone is the best treatment of the bone infection, as it guarantees the complete removal. This results in a bone defect which has to be treated. A very elegant technique to fill the bone defect of any kind, like bone loss after trauma, after tumor resection, removal of site arthrosis or atrophic non-union, is the internal bone transport via my cable technique. This pain-free transport is based on the principles of callus distraction. From the origin bone, a bone segment is cut off and left in place in order that the two cut bone ends want to heal. Temporarily, the bone ends are fixed over a week with a fixating wire until the bone transport should start. Then the wire is removed. The bone ends, like in a fracture, are producing callus. This callus is soft and can be destructed. So in average, 1 week after the bone was cut, the loose bone segment can be transported into the bone defect. For this, the loose bone fragment, which is called transport bone, is attached stable with a cable. This cable is directed internally over the level of the docking bone and through the skin, where pulleys lead the two cable ends to the distractors. These distractors are fixing the cable at the fixator and allowed to pull on the cable, usually in 4 steps of totally 1 millimeter a day. So with other words, the transport bone segment is filling the bone defect with a speed of 10 millimeter in 10 days. The callus at the cut end is growing with the destruction. Once the transport bone has reached the docking bone, usually this docking area is applied with bone transplant to support the healing. With the time, the callus maturates into complete healthy own bone, the bone defect has healed, and the fixator can be removed. According to antibiotic therapy, local application, for example, absorbable antibiotics once can be placed into the defect bone, and systemic antibiotics administered intravenously for several weeks, tailored to the identified bacteria. Dead space or bone defect management can be combined also with application of antibiotic impregnate beads or spacers to prevent recurrence of infection as preparation for bone healing treatments. Beside the internal bone transport techniques are also external bone transport with a fixator used to fill a bone defect. The differences to the internal transport is that the transport bone is fixed with half pins or wires through the skin. That means while the bone is transported, the wires and half pins cut through the healthy skin, producing pain, scars, and additional risks of infection. Another special techniques for filling the bone defect with autologous and or homologous bone is called Mascali technique. The bone defect after debridement is stabilized with an external fixator. The bone defect is filled with a bone cement containing antibiotics. After weeks, the spacer surrounding soft tissue produces a vascularized membrane, which is a good bed for homologous and or autologous bone transplant. After removal of the spacer, this bone transplant can be applied. Disadvantage of this technique is that the transplanted bone has to be absorbed from the body and replaced with own bone. This can lead to recurrence of infection. This bone will maturate first into woven bone and later to lamellar bone, which means that the bone stability will be achieved later as with the technique of callus destruction. Therefore, the internal bone transport via ring fixator with my cable technique is a very elegant technique which can fill any bone defect and need minimum only 2 to 3 centimeter long transport segment. The technique is easy, pain-free, and produces quickly cortical and lamellar bone, which guarantees the best stability. Furthermore, gives the callus destruction with this technique the advantage that new capillaries and vessels are produced by the body, which reduces the risk of infection and improves greatly the healing. I'm using my internal bone transport method with my cable technique since over 30 years. It has a lot of advantages in comparison to the external transport method or other techniques. And I'm very happy of the great success rate in even very complicated cases with no recurrence of infection. No secondary amputation were required. For more information about my cable technique, have a look to my special YouTube video. According to rehabilitation and recovery, regardless of the injury, rehabilitation is a critical component of recovery. The physical therapy restores joint mobility, muscle strength, and function. Early involvement can prevent stiffness and atrophy. Occupational therapy assists patients in regaining independence in daily activities, especially if deformities or amputations have occurred. Psychological support. Trauma, prolonged hospitalization, and impaired mobility can take a toll on mental health. Counseling and support groups are often beneficial. The rehabilitation is tailored to individual needs and may extend over months or years depending on injury's severity.